Hello everyone. I'm just going to jump right into today's live. We are going to be going over some COVID-19 safety basics, just a little refresher as we head into the unfortunately second year of the pandemic. It is still really important for us to keep in mind all of those safety procedures that are in place to keep us all as safe and as healthy as possible. My name is Hannah. I'm the Education and Training Coordinator here at Whitman-Walker. Each week we bring you these lives to help share a little bit of information that may be able to help you or a loved one. So a lot of these tips may be or should be common knowledge to you, is what the information that we have been receiving for the last 2 years since the pandemic began. But I know as we get more and more fatigued, more tired, increasingly more and more tired of being in the same spot we were in March of 2020, it is important to give us a reminder about, what we need to do and what we're doing it for. So with the new Omicron variant, we're seeing a big increase in COVID cases. I know for me personally, I know more folks within the last few months that have gotten COVID than in the beginning of the pandemic, than any other time in the pandemic, really. And so I know that, kind of having this refresher course was helpful even for me. So first, I want to remind everyone about social distancing, so keeping your space from others around you. As more and more things are open without restrictions, concerts and festivals, restaurants are all opened again. And so I encourage you, if you are taking part in those activities, that you consider any sort of alternatives or adjustments to your plans to make them safer. So for example, if you are someone who likes to go out to restaurants, I encourage you to consider taking part in dining experiences that offer social distancing options, or options that keep you outside of the restaurant. So outside is always best when it comes to COVID-19 because it is airborne. Being somewhere where there's constantly air flowing is really important. Trying to find places that offer those little, igloos or, little kind of greenhouse type things that you can sit and eat in with your party separate from everyone else makes it a lot safer. If you're someone who wants to go to movies, for example, instead of going to the primetime 8 p.m. show, maybe you go to the matinee, you go to the show that's at 10 a.m., 12 p.m., where there's going to be less people and therefore allow you to have more space to separate. And of course, the biggest thing right now is to make sure that you are still wearing your masks. I know we're tired of them. I know that it can be really hard to keep up with, but the CDC does recommend that anyone over the age of 2 years old and those with pre-existing conditions that may make them more susceptible to contracting COVID or make them more likely to become seriously ill, need to be wearing masks at all times, especially indoors. For those of us who are vaccinated and don't have pre-existing conditions, it is still just as important for us to wear masks, if not for our benefit, but for those around us. If you are anyone can contract COVID, and whether you are experiencing symptoms or not, if you are positive for COVID, you do have the ability to transmit it to other people. And you are, never fully aware of whether or not someone around you is vaccinated or more susceptible than perhaps you are. And so keeping our mask on, even if you don't believe that you need it for yourself, really consider, how your choices impact those around you. It's important for all of us until we see this pandemic through that we are taking care of each other. In general, you don't need to wear a mask in outdoor settings. However, if there will be, a large crowd, if you're out, say at an outdoor concert or festival, where you're still going to be in close contact with other people, you are still encouraged to wear a mask during that event, even if it is outside. And if you are a resident of Washington, D.C., wearing a mask over your nose and mouth is required in any indoor public space, so restaurants, stores, as well as on any form of public transportation, so planes, buses, trains, ride shares like Uber and Lyft. The biggest way for you to help slow and prevent the spread of COVID-19 is to get vaccinated. Now, I know a lot of folks are still on the fence about getting the vaccine for a variety of reasons, and that is okay. However, getting the vaccine is still the best way for you to slow the spread of COVID, and it works amazingly well at even if you are someone who has the vaccines and still get COVID. If that does happen to you, it does prevent you from becoming seriously ill, hospitalized, or even dying from COVID-19. So it's really, really important for you to still get vaccinated. Even if you think, it's unlikely that you'll get it, if you do, this is the only thing that will really, really ensure that you can recover from it. That is your best bet. So give me 1 minute. So I know for a lot of people, over the last few months, it's been really hard to access any COVID-19 resources as far as testing and vaccination is concerned. So I want to share some of that information with you. So Washington, D.C. has a lot of resources that you can access if you need such things. So starting yesterday, you are able to go online and order 4 self-test kits from the DC government to be sent to your home. Each home is able to get 4 separate test kits. Now I know, of course, there are households that have more than 4 members, but this is just a really easy way to, if you are if you suspect an exposure or if someone in your household is experiencing symptoms, to access a test as soon as possible. You also have the ability to go to any local library in your area. In Northwest, Northeast, Southwest, and Southeast, every public library is offering rapid test pickups. You go, you pick up a test kit, you can do them in your car, on the sidewalk, wherever you need to do it, and immediately drop it back off and just wait for your results. You can also check the coronavirus.dc.gov website, which I will link down below. And you can see which fire stations are holding like the PCR, the one that goes up your nose, those testing sites every day. They are subject to change. So sometimes they are in your neighborhood, sometimes they're not. They're definitely not as widespread as they were maybe, a year ago. But they are excellent options. If you want to see what those options are, I'm going to share that website. It is coronavirus.dc.gov/testing. That is really, really important for anyone who needs a test, or if you just want, just updates for the city. You can just leave out that /testing part and just go to coronavirus.dc.gov and you'll get updates every day on, the booster, on vaccination rates in the city, how to get vaccinated, and where to get tested. It also gives you really handy advice on how to protect yourself from coronavirus. So it's letting you know to get vaccinated, to continue to wash your hands really well, keep your hands clean and away from your face, avoiding close contact with people who are sick, staying home when you feel sick. I know sometimes it's really hard to escape that thought of, it's just allergies, it's just the sniffles. Well, we really are living in a world now where we cannot trust symptoms like that to just be the sniffles or some allergies, because we know that COVID-19 symptoms can range from, no symptoms at all to being seriously ill. There's such a wide range of how you can be feeling that you really, have to take any small symptom seriously. The most common symptoms being seen within COVID-19 are cough, fever, headache, loss of taste or smell, any chills, sore throat, shortness of breath, or muscle pain. If you experience any of these symptoms, please stay home and self-quarantine until you are free of fever or any other symptoms for at least 24 hours. And of course, seek medical attention if you believe that you've been exposed. You want to be tested and, if need be, treated as soon as possible. And most, establishments now have, most jobs are really understanding if that is the situation that you are in. So that is a concern for many people. If you are someone who still has questions about the COVID-19 vaccine, or you are interested in getting it, Whitman-Walker Health is offering it. We are able to vaccinate anyone 13 and up. We have the Moderna vaccine, including boosters, if you're someone who hasn't gotten their booster yet. If you would like to receive a COVID-19 vaccine, you do have to make an appointment. So for vaccination appointments, please call us on our COVID-19 vaccine line. I'm going to also link that down below. You're going to give us a call at 202-207-2480 to make an appointment with us. For DC residents, if you just want to go to like a walk-up location, if you can't get an appointment with us or would rather not have an appointment with us, maybe there's some place that's closer to you, you can also call the number for the DC for DC vaccination information. I'm going to link that down below. Or you can simply visit vaccinate.dc.gov for COVID-19 walk-up locations, So you can just go, see exactly what you need to do, where you need to go, and get the help you need. If you are a Maryland resident, there are other websites like covidlink.maryland.gov that you can go and get the same kind of information. But I encourage you to do so as soon as possible to keep you and your loved ones safe. Everyone ages 12 and up are eligible to receive the Pfizer vaccine. And I know everything is changing every day, so let me double check. I'm sorry. So everyone ages 5 to 11, children ages 5 to 11 are eligible to receive the vaccine, and those 12 and older can receive the booster as of January 6th. So it's really important, especially with these variants that are causing more and more breakthrough cases. If you are vaccinated, I encourage you to get the booster. And if you are unvaccinated, I encourage you to, obtain the information from a helpful source, so that you can be convinced to get it. It really is the biggest difference between, being maybe a little sick versus, potentially dying from this illness. All right, let's see. If you are in need of a test and want to come see us, we also have that available. You just have to give us a call. The number for that is 202-797-4439. Just for any sort of COVID-19 service. If you have questions, please, we have a whole team of people that are waiting to answer those for you. And as always, if you are interested in free HIV and STI testing, we offer those services daily at both our Southeast and Northwest location. They are by appointment only. Just give us a call at 202-797-4439. And if you would like COVID testing, you can give our appointment line a call as well. I'm going to pin both of these. You can call our appointment line at 202-745-7000 or email our team at appointments@whitman-walker.org, and we are able to provide you with all of the care and questions that you may have. I'm going to pin that. We are always here to help serve you and provide you with the care that you and your loved ones need to stay safe and healthy. So just a recap, This pandemic is not over. Unfortunately, it seems like we're going to be in it for quite a while longer. But it is up to us to slow the spread and decrease the fallout, right? So keeping folks out of the hospital, keeping folks here with us. And the best way to do that is to social distance, to continue to wear a mask anytime we're in a public space, and to make sure that we and our loved ones are vaccinated and boosted as soon as possible if you are not already. All right, everyone, that is it for today. I know that was pretty fast. I was really just trying to share some of those services with you to make sure you know. Again, please, if you have any questions at all, please give us a call. That number again, 202-797-4439. We are here to help and support you. Have a lovely rest of your week. I will see you next week. Goodbye.